1. Understanding the kidneys. The kidneys are two bean-shaped organs located below the ribs on both sides of the spine. Their main functions are filtering waste and toxins from blood, balancing fluids and electrolytes, regulating blood pressure, producing hormones that help in red blood cell formation and bone health. When kidneys are damaged, waste builds up in the body. This condition is called kidney disease. 2. Types of kidney diseases. 1. Acute kidney injury, aka sudden loss of kidney function, often reversible. 2. Chronic kidney disease, CKD, gradual, long-term decline in kidney function. 3. Polycystic kidney disease, PKD, a genetic condition that causes cysts to grow in the kidneys. 4. Kidney stones, hard mineral deposits that block urine flow and cause pain. 5. Glomerulonephritis, inflammation of the filtering units of kidneys. 6. Diabetic nephropathy, kidney damage caused by diabetes. 7. Hypertensive nephropathy, kidney damage due to high blood pressure. 3. Symptoms of kidney problems: swelling in legs, feet, or face, edema, tiredness or weakness, nausea, vomiting, or loss of appetite, decreased urine output or foamy urine, itching and dry skin, high blood pressure, shortness of breath, difficulty concentrating. If these symptoms appear, medical consultation is needed immediately. 4. Diagnosis: tests for kidney function. Doctors use several tests to evaluate kidney health. Blood tests: creatinine, BUN, blood urea nitrogen, eGFR, glomerular filtration rate. Urine tests: protein, albumin, and blood in urine. Ultrasound or CT scan to check kidney size, stones, or structural damage. Biopsy: a small tissue sample is taken to determine the cause of damage. 5. Treatment options. Treatment depends on the stage and cause of kidney disease. A. Lifestyle and diet changes for early stages. Reduce salt and sugar intake. Avoid processed foods. Eat more fruits and vegetables. Control blood pressure and diabetes. Drink enough clean water. Avoid smoking and alcohol. Maintain a healthy weight. B. Medications. Doctors may prescribe blood pressure medicines, ACE inhibitors, ARBs, diuretics to reduce swelling, phosphate binders to balance minerals, erythropoietin to treat anemia, glucose control medicines for diabetics. C. Dialysis for advanced kidney failure. When kidneys fail to filter blood properly, dialysis is required. 1. Hemodialysis. Blood is cleaned using a machine 3 times a week, 3 to 4 hours each. 2. Peritoneal dialysis. Uses the lining of the abdomen to filter waste using a special fluid. D. Kidney transplant. If both kidneys fail, transplantation is the most effective long-term solution. A healthy kidney from a donor, living or deceased, replaces the failed one. After transplant, lifelong medications are needed to prevent organ rejection. 6. Home remedies and natural support with doctor's approval. Drink adequate water, not excessive. Eat potassium-balanced foods. Avoid bananas, potatoes if potassium is high. Avoid painkillers, NSAIDs, like ibuprofen or diclofenac. Use herbal remedies only under medical supervision. Some herbs may harm kidneys. Manage stress through meditation and light exercise. Jafen prevention tips. Control blood sugar and blood pressure. Get regular kidney function tests, especially if diabetic or hypertensive. Stay hydrated. Avoid overuse of antibiotics or painkillers. Limit red meat and high-protein diets if kidneys are weak. 8. Latest medical advances, 2024 to 2025. 9. Want to see a nephrologist, kidney specialist. Persistent high blood pressure, protein or blood in urine, unexplained swelling or fatigue, family history of kidney disease, sudden changes in urine volume or color. 10. Outlook. Early detection and treatment can slow or stop kidney damage. Even in chronic stages, with proper diet, medication, and dialysis, patients can live long and active lives. A kidney transplant can provide near normal life expectancy if managed well. Would you like me to make this into a short YouTube video script? in English or Hindi/Urdu mix. That would make it easy to explain this topic in spoken form.